Hello. Well, thank you very much to Tipton Training for inviting me to lecture on dental photography. And off we go. So the first thing I'd like to say is that I have no conflicts of interest with any products which are mentioned in this presentation. So this is purely my independent opinion. So who am I? I qualified from the University of Sheffield in 2001, which is a long time ago now. We have to wonder, where's the time gone? I currently work in Kendal in the Lake District at Crossbank Dental Care, and there's our great team there. And my interests lie in dental implants, IV sedation, managing anxious patients, general dentistry, and of course, dental photography. So my journey with dental photography started with landscape photography. All right, and with lockdown, I've had a chance to do a bit more of that. But I evolved towards macro photography, whether it be non-dental or dental photography. And basically it's trying to find my own artistic expression through that photography. Now, when we look at macro photography of teeth, then you're looking at the hard tissues, soft tissues, you're trying to give back to the patient effectively what they've lost. And it helps us to look into nature. And as Einstein said, when we look into nature, it helps us to understand everything better. If we take another view here, looking at surface texture of teeth, then once you start looking very close like this, then yes, you're providing information to your technician, but it completely changes your perspective on teeth and soft tissues. All right, so it's all about photography being an art of observation and the way that you see things. And certainly when I do checkups and I look at teeth, I look at them in a completely different way now. If you'd like to see a bit more photography like this, whether it be dental, non-dental, then artist.dental, that's my account on Instagram. Now, moving on to the topics that we need to cover today. We've got 7 areas here, and the first area is uses of photography within the dental practice. Now, some people have listed 50 uses of dental photography, but I'm just going to limit it to 10. So the first thing is within patient education and communication, and certainly diagnosis and treatment planning, but also co-diagnosis with the patient, and this also helps with case acceptance. If we're communicating with our dental laboratories, whether you're doing DSD or not, then it's also important to say, for example, communicating the shade, the shape, center lines, and so on. For interdisciplinary communication and planning, maybe communication with specialists. You may have people referring to you for treatment, or you want to send them photos to show the outcome of treatment or the patient journey. Very important for reflective practice and self-education and trying to improve the outcomes for your patients and improving your technical skills. I feel it's also important for orofacial pathology, for documenting that. We work in a very litigious climate, so medical legal documentation, very important again. In some countries, you need to show that you've actually carried out a particular item or items of treatment, so insurance verification. And also if you're doing publications, presentations such as this or teaching, and you need good clinical photographs. Photography is also important in a tool in helping to build your brand and marketing, social media, and so on. And I agree with Christian Coachman's mantra here that we should speak less and show more. And certainly dental photography has a key role to play within that. Now, you'll see, yes, my first photograph here is not a nice photograph, but this is the basics of dentistry. And this is basically showing poor hygiene, periodontal problems, but this is the foundation of everything that we do. And it's also important for showing patient engagement. All right, and you can show them before and after when things are healthy again, and that you're moving forwards. For oral pathology, this is a mucus seal, and it's helpful if you can use a ruler, you can use a graduated probe, such as the Williams probe in this case. And any lump or bump, pigmented lesion, ulcer, etc., same principle. For extraoral lesions, such as this basal cell carcinoma, I think it's also important to document, and this patient was referred for excision. Once again, using a graduated probe to measure this. I mean, it could be a mole which looks a bit sinister, and you can use a probe to record progress or change in that lesion. Some things may look a bit more exotic, such as this one. This is seborrheic keratosis. It's a benign lesion, and you can use the end of one of the old style contrasters, which has a graduated scale. Routine dentistry, patient coming in with a facial swelling, dental abscess. Yes, the tooth was extracted, but this is all part of the patient's story because the patient may have gone on then to have a dental implant, for example. This is smile transformation, smile makeovers. I mean, it's a difficult case here. It's a combined implant restorative case. So you can show the patient before and after. And if I'm asking for a testimonial, then I will give the patient these photographs, and then they can see the change and reflect on their journey. It's a full arch rehabilitation, so it's very useful taking photographs in the aesthetic zone, and you can see the black contraster was used here. Now, it's also important that we're not only showing before and after, but we're looking at follow-ups of our work. For example, here, you can see that at 4 years, we've had a little bit of gum recession at the upper left 6, but otherwise, everything is stable. I've done many presentations at different conferences, such as the ADI, and having a good sequence of photographs, as you can see here, that's the same case, but this is what my first immediate implant case from 10 years ago. And this is just me explaining different aspects of a case to the delegate at the conference. So good photographs, again, are necessary. Now, thank you to Dr. Miles Cohen for allowing me to show this slide, but he presents his cases in the form of a waiting room lookbook. And so new patients will be seeing the journey that other patients have taken, and which helps to market his work directly to his patients. So I think that's a great idea. You can also have dental photo art on the walls. It could be your own cases, or you can buy photographs which have already been taken. These are taken by Dr. Miladinov Milos from Dental ProMaster in Romania, a really excellent photographer. And also for publishing articles, just a couple of articles I've written there on photography. And this is a zirconia crown, and yes, I'll put this up on my Instagram account, but it's basically showing a simple routine thing that we do all the time, but in a different light. So you're making your work stand out from the crowd. On social media, this is on Facebook, and yes, you can have testimonies from patients. You can have your picture next to the smiling patient, but it's very important that you obtain valid consent. And if you're going to put a picture like this up, for example, in this lecture, we reconfirm consent with the patient to make sure they're happy for you to show that photograph. And very important to understand that consent is a process. It's not just ticking a box on a consent form. So this must be documented in the clinical notes why you have taken these photographs and that consent was obtained. Okay, in the next section, it's quite a big section, but we're looking at camera equipment. So there's many, many options out there. We've got compact cameras, we've got intraoral cameras, we've got smartphones, we've got tablets, we've got digital SLR, mirrorless cameras. Which one of these should we choose? So if we look at each of the options individually, first one here is called a Dyn Digital Solution. It's a compact camera. There's a little arrangement of lights around the lens to try to give even illumination. It's got good features in terms of you can vary the f-stop, which as we know helps with depth of field. You got Wi-Fi transfer, and you can shoot in JPEG and RAW format, which many compact cameras won't actually do. It's usually JPEGs. And there's the price tag. This one from ShowFood, iSpecial C3, the C4 has recently been released. Also a pretty good option. And you've got touchscreen functionality. You don't have to worry about changing the settings. You just change the mode according to what you're doing, whether you're doing surgery, whether you're taking occluded photographs, portraits, etc., or shades, and the camera automatically changes the settings. The only problem with this camera is the price. If they could bring that price down, I think it would appeal to a wider audience. Next option is intraoral cameras. And umpteen numbers you can buy on Amazon, eBay, but you will get what you pay for. And the one which seems to be the market leader is the Iris series of cameras from Digidot.com. Once again, this is quite a pricey camera, but it's got a lot of plus points. So it's ergonomic, it's easy to hold, it's portable, lightweight. You got it for infection prevention and control. We've got a nice barrier sheath you can take off, connectivity to your computer. We've got LED lights, and it also has the ring flash attachment, which I never knew you could get for an intraoral camera. You can shoot intraoral images, which I would suggest you mainly use it for, from single tooth up to full arch, and also apparently extraoral images. Now, negative points here would be, usually my previous experience with intraoral cameras is that it had a small angle of view. This also depends on your model. And when you're showing things to the patient, you may be presenting more single tooth dentistry as opposed to comprehensive dentistry. Image quality, once again, I've not seen the quality of images from this particular camera, but in the past, when I've looked at these, because you're very close to the subject, you're very close to the tooth, then potentially issues with perspective distortion, and also when we're looking at reproducibility of the images. And yes, the ring flash is good according to the feedback here from the reviewers, but decided it would not replace a digital SLR camera. But potentially this could be a useful adjunct. Next thing we're looking at, I think is a good idea here as well. It's called a dental iPad, and there's a bit of artificial intelligence integrated within it. So when they set up the workflow, you take your image or a series of images, and it walks you through the process, and it automatically transfers it to the computer. You can transfer it to the dental technician. It will flip, crop, rotate images for you as well. So this is saving you time. Also, if you had an intraoral camera, I think it's about 399 euros additional cost, but you can connect it to the dental iPad to show the patient, and there's the cost there. Now, a few years ago, Professor Louis Ardan in Lebanon devised this tool called a SmellLight MDP, which is very popular with smartphone users. And you see here, we've got these two little panels which magnetically clip on. Those are called diffusers, which soften the light. And this little thing here is a polarizing filter when you're trying to eliminate reflections. And there is in use, and the current prices that I could tell was looking at just over £500. UK Dentistry is out of stock at the moment, but theirs is just under £400. So that was the cheapest on the market. Now, in my opinion, the digital SLR is still the gold standard for dental photography. Today, many people are moving towards mirrorless, but there's pros and cons of each option, and it's up to you to make your choice. Now, what's the difference between these two types of cameras? So this digital SLR, you've got the light comes in through the lens, it bounces off the mirror, goes around a little pentaprism, and then comes out the optical viewfinder. For the mirrorless camera, the light comes through the lens and straight onto the sensor, so there's no mirror. And because of that, you've got a much smaller camera. The camera body is smaller compared to the wider camera body here with the digital SLR. And you're also running two screens, so that electronic viewfinder is effectively another screen that you're looking through. So there's increased power requirements there. All right, and if we look at the form factor of the cameras, we've got a wider body here. I mean, it's a full frame Nikon camera, and then a much smaller body here for the Nikon Z7. And yes, the weight is a bit less, but you need to think of it in terms of when you put the whole camera system together, put the lens, you put whatever flash system you wish, is this ergonomic for you to hold? Is the whole setup balanced? With mirrorless cameras, we often find that it's very front heavy, so towards the lens and the flash, also depending on which of these you're using. If you're using a dental microscope, then yes, there are little attachments you can buy to attach your camera to the microscope. And also, you can also have mobile phone adapters as well, which I learned when I was preparing this lecture. And some people also attach flash systems. I mean, this is a Meike MK24. And you get different lighting. So overall, when you're choosing a camera, there's some key things to consider. One, is it simple? Is it quick to use? Is it versatile? You may want to use it for non-dental use. Is it ergonomic? Does it fit comfortably in your hand? And certainly when I was choosing my camera, I went to a camera store, or you could speak to a colleague and see what feels best in your hands. When we look at teamwork, many times it is your assistant or dental nurse or TCO who's taking these photographs, and they tend to prefer lighter cameras or smaller cameras. And also we have price. Also, we're in the current environment when we're in the COVID-19 environment, and I addressed that at the end of the lecture, but we need to consider the environment that we're shooting within. And also having a toolbox, so maybe have more than one photographic tool. So ultimately, it's up to the clinician to decide what type of camera will suit your needs and applications best, and you need to seek out appropriate training using that equipment. And yes, price is important, but this investment will give you a very big return on investment, as Dr. Richard Fields says there. All right, so the first thing we'll look at is the digital SLR camera body. Now, this camera is Nikon, Sony, Olympus. Most people will be Canon and Nikon. It's about 50-50. You've got 3 grades of digital SLR cameras. We've got entry level, we've got mid-range, we've got high-end. There's some cameras beyond this high-end as well. But for dental photography, you want to be sticking with either mid-range or entry level. Cameras that I've used in the past, when I started earlier in this series here, I was using the Canon 40D, and I used that for many years. And then I use a Canon 7D Mark I. And you can get cameras like these on eBay secondhand for much cheaper than a brand new camera. If you want smaller form factor, then you can go with these models as well. Now, there's 2 cameras which you need to have caution with, and these are really not suitable for dental photography. These are more the entry-level cameras, and the question is why? Now, if we look at the top of the camera, and this is called a hot shoe. This is where an external flash will connect onto your camera. Now, in the 1500D, you can see here, Canon is taking away that the fifth metal circle. If you look on the 200D Mark I, you still have that 5th circle, which means that Canon is limiting you to their particular flashes, well, certain specific flashes. So you can't use third-party flashes which are cheaper, such as a Yongnuo. So I'd recommend you avoid anything which has only got 4 pins. Stay away from that, especially if you're looking to take your dental photography further. Now, another question that we often get as well, should we go with a crop sensor? Should we go to full frame sensor? And the difference is basically the size of the sensor. I'm not going to hit the dimensions of sensors. Essentially, crop sensor is smaller, full frame sensor is larger. Now, the crop sensor cameras are lighter, full frame tends to be heavier. Yes, there's different issues there with like inbuilt flash and so on, but the key thing here also is that the crop sensor cameras are more affordable. So certainly I recommend you consider that option as opposed to full frame. If we compare these again, and this is an experiment that I did, we basically, we take the case is a denture, we take the denture, we're at a fixed distance from the denture. So my camera's on a tripod. I used the same lens at 1:1 magnification, and all I did was just vary it between a full frame sensor and a crop sensor camera, so 2 different cameras. And these are the results that you get. So on the crop sensor on the left, you see that we've got a smaller angle of view, so you're not seeing as many teeth, whereas on the full frame sensor, we have a larger angle of view. So the image on the left, the crop sensor appears to be zoomed in or cropped. And that is where we get the term crop factor. Some people call it format factor. And on the camera brands, it's very similar. So 1.6 for Canon, 1.5 for Nikon. And therefore, you take that crop factor, you multiply it by the focal length of your lens. In this case, I wanted 100 millimeter macro lens. And your effective focal length is 160 and 150 millimeters, respectively. So what this means is that you're standing a bit, to get the same composition, the same framing, you need to stand a little bit further back from the patient. And so overall, the advantages here of the crop versus the full frame sensor camera is that you got a greater working distance for the crop sensor, and you can manage the light better. Later, when you're progressing your down photography, if you're using soft boxes, bounces, etc., brackets for wireless flashes, etc., then you need to be able to bring that light in from the sides, okay? If you're very close to the subject, yes, you get away with a ring flash, but if you're coming from the sides, you need a bit more room. And the closer we go to a subject, the depth of field reduces. So if we come back from the subject, then the depth of field increases. So you get a better depth of field with the crop sensor camera. All right, so the next section is basically choosing a macro lens. Now, for Canon, these are the compatible lenses I would recommend. This is not an exhaustive list. For Nikon, those are the two main lenses which are compatible. There are other camera brands lens brands out there, such as Tamron, Tokina, which may be a little bit cheaper, but I'm a Canon user, and I use because photography is my hobby, okay, so I use this one, which is the L series lens. But when I started out, I was using this one, which is the gold ring, the normal lens, okay, and that achieves good results as well. Now, top tips when you're choosing a macro lens, okay, and it needs to be a dedicated macro lens, not a zoom lens, but a dedicated macro lens. You need to check the compatibility of the lens and the camera body. I'd recommend using 100 to 105 millimeters. There's all discussions about this. People recommend from 85 to 105 millimeter, also depending on which sensor is on your camera. But 100 to 105 is what I would recommend. Your working distance needs to be comfortable. Some people like to be closer to the subject, say with a 60 millimeter lens. I prefer 100 millimeters on a crop sensor. And internally focusing lens basically means that when you are focusing the lens, okay, the lens is not becoming longer, all right? So it stays the same length effectively, physical length of the lens. And that's important because in terms of how you manage the light, in terms of the flash moving closer to the subject. Now, image stabilization, do we need this? No, we don't need this for downward photography because we're working at very fast shutter speeds, which I'll explain when we come to the settings section. Manual focus is important, and that little area here, the little window, which you can see here, that's a little focusing window. And that shows you not only the distance from the subject, but also the magnification ratio. So we're not using autofocus, we're using manual focus with the lens. Right, third area, we're going to look at flash systems. Now, essentially, when people say you're looking for a ring flash, for example, and people go onto eBay, you have a look and say, well, this looks very affordable. So yes, £27, let's go for the ring flash because it says so in the title. But this is actually a continuous light, which is not suitable for downward photography. Maybe for video, but not for taking photographs. So flash systems boil down to either a ring flash or twin flash, which can either be wireless or wired. And there's many, many systems on the market. And this is my survey of all the ring flash systems currently on the market, and I've organized them in terms of price. If you're starting out, okay, and you're on a budget, then I've used Yongnuo, which is fine. Or this one to make it, they're almost the same. If your budget is a little bit bigger, then either the Nissin or the Metz, which has there's no wire, it's wireless. That one is good as well. And obviously we need to check compatibility. Now, if you look at the bottom, the middle on the bottom there, there's these little circles, and these are called lens adapter rings. So this will screw into the end of the lens, and then you clip on the ring flash. And depending on the diameter of your lens, it will depend on which adapter ring you choose. For the twin flashes, I mean, there's many on the market. Okay, these are the main ones. Now, the Canon, I've used this one since 2009, and that's a good one. The upgrade is this one here, which I can't justify spending on that. And if you're on more of a budget, then this one, I've seen people use this one, and it appears to be a good flash as well. The wireless flash here, the Meike, okay, that is very popular these days. And certainly you can see it's compatible with not only Canon and Nikon, but also Sony cameras as well. So why should we choose a ring flash as opposed to a twin flash? Now, if you look at the diagrams here, you can see that with the ring flash, the light is coming straight at the teeth, whereas with the twin flash, it's coming in at about 45 degrees or from the side. And so therefore, the ring flash is smaller, the twin flashes are larger. Ring flash tends to be easier to use, whereas the twin flash has a steeper learning curve. Because the light is coming straight at the subject, and you're going to have virtually shadow-free, consistent lighting, which is great for occlusive photographs. With the twin flash, we can be using brackets to hold a flash, and you've got more flexible lighting options. The images with the ring flash tend to be more flat, whereas the twin flash, they're more three-dimensional. And so this is better, much better to use a twin flash within the aesthetic zone and also for shade management. This is an old photograph, but essentially showing you the pattern of specular reflections. And yes, I aimed a bit more from the cervical here, but it's pools of light, little circular rings of light with the ring flash. Whereas with a twin flash, you can see the line angles are more well defined. Right, photographic accessories. There are three main types of photographic accessories. We've got retractors, we've got mirrors, and we have contrasters. You can buy these separately, or you can buy specific kits, such as these ones from UK Dentistry, Indigo Dent, which is given a birth in Dr. Andrew Chanapal, and Mike Charlin's site, which is the one on the right here. Here are the prices of these products. And then you ask yourself, well, why is one cheaper than the other? Well, the one on the right, the cheaper option here, these are metal mirrors, whereas these ones here are glass mirrors. You can also look internationally. For example, this is Dr. Mayer Davda. Thank you very much to him for sharing this slide. And these are metal mirrors, but they're affordable. And he's also selling the full kit, which he calls the magic box. So you got your retractors, you even got a gray card in there, etc., and instructions on how to use the kit. Retractors. Now, the purpose of retractors is to move the lips and the cheeks aside to allow photographs to be taken of the area of interest, which you can see by the arrows. There's different types of retractors. Effectively, you've got, according to whether it's self-retaining or individual, these can be either plastic or metal retractors. They can also be single-ended or double-ended. Now on the left side here, this one is called the Oranger retractor, which is useful for surgery, but not very comfortable. So only short periods of time would we use that. This one here is more of a Columbia type retractor, which is popular with some people. But when I started out, yes, I was using that, but I moved away from that, apart from when perhaps for surgical photographs. Some people prefer Optrogate. So if you're doing, for example, orthodontic bonding or restorative procedures, you can use that to help with your photography. And there's even retractors like this one from Practicon, which has a little bit here to retract the tongue or to help keep the tongue still. So basically, you choose a retractor according to what you're using it for. Now, when you look at the ends of retractors, effectively you've got a C shape or V shape. C-shaped retractor ends are much better when we're looking at the anterior retracted views and not very good for the buccal retracted views, as you can see here. See how the cheek is in the way here, whereas on this one, we can see all the way back to the 7th. So for the buccal retracted views, the V-shape is better. Top tips when you're using retractors. You should have a range of sizes and types available because each patient is different. And you're choosing the appropriate retractor for each patient and situation. We should wet the ends of the retractors before we insert it into the mouth because it's more comfortable, and you don't want to leave the retractors for longer than necessary. Very important that we follow the manufacturer's sterilization recommendations. Otherwise, this is what happens. So this is permanent retractor distortion, and that is no longer comfortable for the patient, so that one had to be binned. If you get the temperature on your autoclave wrong, then you get surface damage to the retractor, which does not look great in your clinical photographs. Mirrors. Two types of mirrors. You have glass mirrors and metal mirrors. The glass mirrors need to be front surface coated, and whereas the metal mirrors are basically stainless steel, which is highly polished. On the right side here, you can see that this mirror is actually a combination mirror. So you got occlusal and buccal all in one, which can be useful. The reflectance of the glass mirrors is higher. The reflectance of the metal mirrors is lower. So you may need to, if you're using metal mirrors, you might need to tweak your camera settings a bit to make sure your image has the appropriate brightness or exposure. For the sizes, different sizes of occlusal mirrors, you have small, large, and extra large. I mean, I have all three sizes, but the large is the one I recommend we use most often. Buccal mirrors can either be tapered or more of an S-shaped design, as you can see here. And then you've got hybrid mirrors, which combine the two. Now, if you look at mirror reflectance, so why do we need the front surface reflecting mirrors? Now, when the light comes in on the front surface mirror, it hits the surface and bounces straight off. If you have a rear surface mirror, so the coating's at the back, then when the light comes in, it will go through, a bit will bounce off the surface, a bit will go through, bounce off the middle, a bit will go through to the coating, and then come out again. So the light is all over the place. And if you look at an example here, this is just an extracted tooth. On the dental photography mirror, we have a clear reflection, crisp, no problems. If I put it on, this is on a face mirror, then we've got non-ideal reflections. There's all these ghost images which don't work. At least don't work for me. So you want a clear reflection. Now, coatings. If you look at the different types of coatings, you've got chromium, you've got titanium and rhodium, which are about the same, 75% reflectance in terms of how much light comes back. And you've got these dielectric coatings, the ultra bright, which is apparently 99%. And the manufacturer says that they've got 112 layers within this coating, which is why it is so bright. Whereas in other mirrors, other cheaper mirrors, then you only have 2 layers. And apparently this not only improves the reflectance of the mirror, but also improves the durability. Metal mirrors, the reflectance is lower, maybe around 50%. And this is all reflected here in the price tag on these different options. So metal mirrors will be cheaper, as you saw previously, and the dielectric ones are top of the line. Now, I've never used a dielectric mirror. I've used chromium and rhodium mirrors, okay? And these work fine. Because remember, you will have to replace these mirrors. And in my view, it's better to have 2 affordable mirrors rather than have a very, very expensive mirror that you then have to replace again within a relatively short period of time, depending on obviously how the mirror is treated. Handles, it is essential to use a handle. Now here we have 2 non-ideal photographs where fingers, and some of these are actually the nurse's fingers, okay? And on the right, we've got gloves in the photo, which is not acceptable. On the photo on the right here, you can get away with cropping this image here, rotate, flip and crop, okay? But it's still not ideal to have gloves in the shot. So we get around this by using a handle. Now the first handles which were designed were fixed metal handles, and we've also got these ones from Filtrop, plastic handles, which are good, they will work, but you have limitations. For example, here, your mirror, you only have access to one side of the mirror because the other side is holding the handle. So as opposed to the other types of handles where you can use both sides, if this side gets cracked or scratched, then you have to go and buy another mirror. And also when we look at if you look at this one, for example, here, all right, that little bit there where the handle slots in, that's maybe 3-4 millimeters. And if your patient has not the widest mouth opening, you just lost 3 to 4 millimeters, and you're not going to get an ideal photo. Now, Photomed came out with this one, which I tried when it came out, but I'm not a big fan because that little mechanism inside failed within 6 months. But once again, it may work in your hands. These ones from Doctor's Eyes, these little removable silicone handles. They look good, and yes, they are bright. My only problem here would be the size of the mirror, so you have to make sure you choose the right size. Now, the best one to me is this one here from I buy mine from DB Orthodontics. And these ones are flexible stainless steel with a nice little silicone coating. And it's very easy to use, very reliable, and they last a long time. And these definitely will get your fingers out of the shot. Now, fogging. So how do we reduce fogging? Now, cold mirror inside a warm, humid oral cavity, this is the problem that we're facing. So how do we get around this? So the first thing, when I first started, I was getting a patient to hold their breath, but I found that you're putting a patient under more stress. They're already having to open wide. So I went away from this. I need my patient to be more relaxed. You could get them to breathe through the nose as if when you're taking a dental impression. Having a mug with hot water. I use this quite commonly, and the heat from the mirror will last a few minutes, but you need to make sure that you don't burn the patient. Now, prior to COVID-19, yes, you could blow airflow over the mirror to get rid of any fogging. In the current climate, I would not do that. You can buy a mirror warmer to keep the mirror warm, okay? And there's the price of that. So I've not used that yet. You can buy from Jacobi.com. You can buy this, which is basically a fog-free mirror has a little fan and also a little LED light, which helps you to focus. And there's different packages according to your budget. Contrasters. Now, why would we need a contraster? Well, the purpose is to eliminate a distracting background. On the left side here, we can see the tongue in the background. Sometimes you might see the lower teeth. With a contraster behind the upper teeth here, it is just a much cleaner image. It also highlights the incisal contour and the embrasures, and when you're looking at translucency of the incisal ledges and characterization in the teeth, the contraster will give you better results. Now, contrasters started out back in 2001, 2002 with Nichromanox, and these are black anodized aluminum contrasters. Now, problems with these were they're not flexible. Okay, so they're less ergonomic to use. They will pick up scratches over time. And because they're metal, even though they're anodized, you can still get, if your angle of your contrasters is a bit off, then you get little reflectance issues. So the background is not as black as it could be. So for this slide, I'd like to thank Dr. Jordi Manuata, who is from Mexico originally, but he lives and works in Italy, a very good dentist. And thank you to him for allowing me to use these images. So he looked at this problem back in 2004. And when a member of his family was basically saying, well, you know, that metal contraster is cold, it's sharp. And Dr. Manuata said, well, okay, what can we do to get around that? So he coated an aluminum contraster with nitrile rubber. And then from there, they then took it to Dr. Walter Devoto at Stella Italiano. And the Stella Italiano prototypes were made back in 2011. And that photograph here shows you the evolution of the different contrasters. So it's a brilliant idea. And so today we have the Flexi palette, which is basically a flexible copper sheet called medical grade silicone. It comes in form A, B, and C, according to which area of the mouth you're using it in. And there's loads of advantages here. So you've got, they're way more comfortable for patients. They're flexible, so you improve ergonomics. If you don't have somebody assisting you, then they can also be self-retaining. They don't scratch. You get a blacker background because it's low reflectance, and they are autoclavable. So this was promptly copied. So Flexi Palette was then copied by Photomed, who came up with their own line, but no, they're using stainless steel as opposed to copper. And then Nichromanox then copied Flexi Palette as well, once again coming up with their own designs. Now, if your budget does not stretch to these, I mean, these are a good investment, whichever one you choose, okay, then you can improvise. All right, so take a little bit of black cardboard, cut it to shape, and this is your single-use contraster. So you can experiment with this before you buy them. Right, so halfway through, now we're looking at the basics, camera settings. How do we understand these? Now I'm gonna cover the main ones, okay? So first of all, what is the definition of photography? Now photography, the word comes from Greek and it means phosphor light, graph is for drawing, so effectively you're drawing with light. You can take this further and basically take it as it is the understanding the language of light as well as shadow. And exposure is the amount of that light that reaches the digital sensor in your camera, or in the old days, film. So this takes us to the concept of the exposure triangle. So we've got aperture, we've got shutter speed, we've got ISO. Now, all the settings I'll describe coming up next, you need to be shooting within manual mode, okay? So you're not using automatic mode, okay, or program mode. It has to be manual mode. Because a common finding, let's say you set your camera up, it's on the clinic, if your camera is being shared by more than one person, then if somebody changes those settings and either, oh no, my photo's not coming out as nice anymore. So if you understand aperture, shutter speed, and ISO, all right, you're able then to troubleshoot your images as you go. And you can change them back to what the setting should be. Now, aperture. Now, the camera, it helps if we look at the human eye. So the pupil of the eye is effectively the aperture. The blinking speed can be regarded as the shutter speed. And if you close your eye, open your eye, and then close it again, that's effectively what we are referring to. The camera's sensor is the retina of the eye, and how sensitive that is to light is your ISO. So the aperture refers to the opening in the lens through which light comes into your camera. And the aperture value is either called an f number or an f-stop. Now, these little diagrams basically show you when we're going from a wide aperture out to a small aperture, right? And the numbers go in reverse. So the wide aperture, the f number is lower, and for the small aperture, the f number is larger. And that basically means we're letting in more light with a wide aperture and less light with a small aperture. Now, this relates also to depth of field. So what is depth of field? Depth of field is basically what is in focus in your image, or the range of focus within your image. If we look at these two photographs, you can see that in this picture, the little girl's face is in focus, but everything around it is out of focus. So that is what we call a shallow depth of field. If we look at landscape photography, when you want everything to, well, everything in the image to be in focus from front to back, then you need more depth of field, so a smaller aperture. So in dental photography, we need to be using apertures around f22 to give us more depth of field. And if you look at these two dental photographs, you can see I've shot one at f2.8. And in this one, if you look at the periphery, can you see that's all blurry and out of focus here and here? If you look at the image on the right, shot at f22, then most of this image is in focus, which is what we're aiming for when looking at intraoral photographs. Now, the 1/3, 2/3 rule. Sometimes this can be controversial. I know not everybody agrees, but for my purposes, this helps to explain why we do what we do. So now we're looking from the front in this image. It's not an occlusal view, we're looking from the front. Now, the little green dot is the focus point. If I'm focusing in the middle of those central incisors, then the blue zone shows you the depth of field. So if I look here, then the back teeth, they're out of focus. You're losing depth of field. If I focus between the canine and the lateral incisor, then 1/3 in front will be in focus, and then 2/3 behind that point will be in focus. And that shows you the view there from the front. So you're maximizing the depth of field in your image. So it's useful to have this in mind. Shutter speed. Now this is the time that basically the light is allowed to enter the camera to hit the sensor. And some people will call this exposure time. If I have a very fast shutter speed, I'm freezing the action. If I have a much slower shutter speed, as this example of light trails, then you're basically showing movement. And this little chart here basically shows going from, say, a very slow shutter speed up to a very fast shutter speed. And in dental photography, we need fast shutter speeds. So I use 1/125th of a second, which is 0.008 of a second, so it's very fast. Some people use up to 200ths of a second, right? But essentially here, we're using flash. We don't need image stabilization, okay? And this all leads back to using a fast shutter speed. Now, ISO basically refers to the sensitivity to light of your sensor in the digital era. It used to be film. And this is a scale of ISO. Now, on the left side, we've got, for the low ISO numbers, the sensor is less sensitive to light. It's going to capture less light. You need more light for a good exposure. We're using flash. And you'll find that your image is less grainy, there's less noise in your image. So in dental photography, you want to be shooting between 100 and 200. Opinion is going to vary according to whether you're using Canon or Nikon. I mean, I use 100 for mine, and that works for me. So here is an example of a clean image versus a noisy image, and you can see the ISO values. And most of the time, we want to prefer the clean image. It's hard to illustrate this in dental photography, but with flash, you can see here we've got the image is much crisper, it's cleaner. If you look really close, you can see the noise is increasing in the image if you look at the interdental papillae. And in this one, I turned off the flash and just using ambient light, and look at the grain in that image. So keep the ISO as low as possible to minimize noise. So a summary of the camera settings, essentially we've got, this is your exposure triangle. Apertures, you can use an f/22 for smile, intraoral photographs. For portraits, I use f/11 because I'm further from the patient. You need a fast shutter speed, my shutter speed does not change. And the ISO is 100 to 200. And that cheat sheet is available online. Now, photographic protocols. Protocols, some people have said are more important than the equipment that you use, and I would agree with that. Protocol allows you to achieve consistency. And my policy here is better to have and not need than to need and not have. So if it's the presentation case, especially, then I'll be taking more photographs than I think I need. All right, so the two most common photographic protocols are either AACD or the BACD. The AACD is a subset of BACD because you've got basically 12 views for AACD, 15 views for BACD. If you're doing orthodontics, then you've got 8 views, standard views, and then you've got optional orthodontic views. On the left side, this is from the Institute of Medical Illustrators in the UK, and that's regarded as the gold standard for orthodontics, for orthodontic photography. Now, if you're doing digital smile design, then you can either shoot 6 views, as shown here, and that's from an article on Dental Photomaster. And these views here, this is the simplified photo protocol for DSD. Now, I know that they tend to do videos these days, and then you're doing screenshots from the videos, but you still need a basic photographic sequence from that. If you look at the differences in terms of BACD, all right, we've got, these are mirrors have been used for the buccal views. They've got a lower contrast view. This one here is called the 12 o'clock view. And then they've got functional views here for anterior guidance. So there's subtle differences in the protocol, but once you have the basics, you can adapt to any protocol. Now, if you're starting out in dental photography, I'd recommend you follow the BACD photographic protocol. This will lay down the basics, and then you can extrapolate from there. So we've got portrait photograph, we've got smile views. These ones here are called retracted views, teeth apart, teeth together. You've got close-up views within the aesthetic zone. And then we have occlusal views. Now, if you're pushed for time, all right, or if you're starting out and you say, well, okay, I only have a very limited time to take photographs, then I would suggest you use an abbreviated photographic protocol, which is just taking 4 photographs. You've got a smile view, so you can show the patient, well, okay, if I did a filling on that front tooth, how would it affect your smile? how we replace your missing tooth. A split arch view here, which will show you, for example, the periodontal health deposits on the teeth, shaded teeth, and so on. And you have the occlusal views, which are great for showing fillings, broken teeth, missing teeth, and so on. All right, so you can start small and then build from there. This is just an example showing following the BACD sequence for a patient. This is quite an old case. But then if you push for time, and this is an example showing an abbreviated protocol. And this is an implant case. And you can see the areas of interest. So she had 4 implants and a bit of restorative work. But the photographs, in addition to building that connection with the patient, all right, helped a lot with case acceptance for this case. And she was a very, very anxious patient. I call these ones hygiene views. And when you've got loads of calculus, soft tissues which are inflamed, and it's helped to show these before and after when you remove the deposits. So it is a very useful educational tool. As part of my implant follow-up protocol, in this case, the patient said, yes, my denture is not seating. And then you show them that, yes, you've got buildup on the denture, and then you're damaging the inserts. So here, showing that big block of calculus, and say, well, we need to clean around behind your abutments a bit better. So I often take photographs there. Okay, now, if you look at the settings that are used for the BACD protocol, you've got the portrait, smile, intraoral, and close-up. Now, I don't necessarily agree with all of their settings, all right, because it is hard to get standardization within dental photography. But this shutter speed of 1/200, they're probably going to be shooting at full power on the flash. So that will work fine for them. For the ISO, for portraits, I prefer 200. You can try either. For the white balance, okay, once again, there's different views on this, but I would suggest that experiment between having your white balance on flash, having it on daylight, and then presetting it at 5500, or some people say 5560 Kelvin. And whichever of those you like better, then stick with that. Now, the magnification ratios on this table are basically referred to crop sensor cameras. If you're using a full frame camera, then the magnification ratios are slightly different. But the majority of people will be using crop sensor cameras. All right, so this is a summary of the settings that I'm using. For portraits, once again, we've got f11, ISO at 200, and my flash power is on full power, because you're further from the patient. For smile and intraoral views, I've shut down the power to 1/4. And for close-up views, almost the same. Now, very topical issue here now. So COVID-19 and dental photography. So we're getting near the end now. Now, when the FGDP published their guidance, there's a section on dental photography. And they're suggesting that the low-risk photographs are the extraoral photos, and that you should do a risk assessment of the patient's cough reflex to determine whether should you do intraoral photographs. And then obviously here we need to be avoiding use of the 3-in-1 syringe, which is perceived as an AGE. So here's how I looked at it. I said, well, okay, we can risk assess the patient. We can risk assess the clinical situation. Justification. So just like justifying radiographs. So why are photographs needed? If we don't have a clear justification, then during this time period, we need to avoid dental photography. Mitigating factors, there's a whole list of these, which I'll go into. Documentation, so you need to document all of the above. And then finally, keep your protocol under review. So it's basically a living protocol. So mitigating factors, we should store the camera equipment when it's not in use, consider an abbreviated photography protocol, which I already discussed, risk assess the photographic views. Now I'm suggesting here that we can also have this concept of a shortened dental photographic arch. All right, so instead of taking 7-7, you may want to take 6-6, 5-5, 4-4 to avoid triggering off that cough reflex. For contrastive views, yes, decide whether you're going to use them or not. Position your contrastor a bit more anteriorly. You need to avoid aerosol generation. You can use a high volume aspirator to dry the teeth. We're going to be using rubber dam a lot more, so photograph under rubber dam. And you can also consider the use of live view or even videography. Now, PPE for camera equipment. Now, dentist.camera is a great website. There's loads of resources on there. You can register with the site. The fee per year is not very much, all right? And it's a resource where photographers can get together, share ideas, and so on, and support each other. So one of the photographers from Italy put out this protocol back in April. So essentially, you've got a polythene bag, and this shows you the protocol for donning the bag onto the camera. And this bit here, I mean, this is a twin flash setup, but before this was clicked on to the camera lens, he basically folded the plastic inside and then clicked it on. You can also double glove, all right, and also consider delegating photography to an assistant. Now, even if you're using bouncers and so on, you can still use a bigger polythene bag and still use the same donning protocol. And that's just an example of a camera with PPE in use. Now, for your lenses, I'd recommend that you buy a UV filter, or some people call it skylight filter. You pop it onto the front of the camera. So when if you're doing surface disinfection of the front of the camera, because that's the only bit which is exposed here, okay, then you're not scratching the lens, all right? Because lenses cost a bit of money. You need to protect them. Now, in terms of surface disinfection of the cameras, the Shofu Eye Special, within their documentation, they said it can be disinfected using ethanol. I'd recommend that you contact your camera manufacturer, and this is from Canon. And basically, you can see here, they're suggesting that we use an alcohol-based cleaner. We should wipe rather than spray, because you don't want to damage the camera equipment. Make sure that you don't put any of that alcohol inside the camera, and avoid non-alcoholic wipes. Okay, so we've looked at all the different options for photography. So as part of our mitigating factors, we should consider perhaps a flexible approach to photography equipment. So maybe have more than one option. And Dr. Alessandro De Vigius coined the term COVID camera. So these may be more appropriate to use at this time because you got easier surface disinfection. And yes, I know there are limitations of these cameras. It's not the gold standard, all right, but be flexible. We can also take the photography out of the dental office and delegate it to the patient. So the patient can photograph or video themselves at home, and we'll come to that in a moment. And certainly virtual consultations are going to be the way of the future, right? So they will be taken up more to try to reduce patient contact at this time, certainly. So I'm nearly at the end now. So mobile dental photography. There's some key things to consider. So number one, the recommendations, and these are from the dental legal providers. We should use a dedicated mobile phone, not a personal mobile phone. There should be no SIM card in the phone, no connection to the cloud. So essentially it just becomes another camera. Another thing I add on here, you could consider using the patient's phone. Now, with the mobile dental photography, you're using a continuous light source, what is termed an external artificial light source. The most popular ones on the market today, we've got Smilelight MDP. You've got two lights from Photomed for smartphone, as well as for the iPad. And then this one here from Cocolux. And we've got either 3 groups of fixed LEDs for the Smilelight. You got these 2 LED panels for the Photomed versions. And then you've got the split LED ring, which you see can rotate either horizontal or vertical. And those are the costs of each one. Now, Dental Monitoring has created this cool device, which is for only £53. And it's a very clever design. So essentially, you choose the size of retractor, small, medium, or large, and you can buy it. And the scan box with a phone within it, as you can see here, all right, that then basically clicks onto the retractor magnetically. And then the patient is using the dental monitoring app, and it guides them through the photography protocol. And then we've got secure image transfer through that app. So I think that's a great idea. It'd be nice to try that out as well. All right, so last slide. So because, for example, we've been dealing with a lot of emergencies and more kind of virtual consultations and advice, and on the British Orthodontic Society website, there's a video link there which teaches the patient how to take photographs with their phone and effectively using their fingers as retractors and somebody else holding the phone. And then this app here, Hospify app, is a free app which is approved by the NHS for both patients and clinicians for secure data transfer. Thank you very much. And that's it.
So I think we just put one question on the Q&A now.
Okay. Let's have a look. How best to store photos? Okay. All right, good question. I mean, I store mine basically in folders. They're all organized and kind of case numbered. But I also, the vast majority of my photos will go straight on to the Dentally, the patient management application that we use. So I shoot both JPEG and RAW, and then I edit my photos, import them onto Dentally, and they're basically securely stored in the cloud on that patient's notes. So that's the method that I would use. Now, there's another program called Dental Notebox, all right, if you look it up on Google, and that essentially it's a platform where you can upload your photos. And yes, they do go into the cloud. And you then allow different permissions between, for example, your dental technician and yourself, or if it's an interdisciplinary team. So you all have access. And it also allows you to say, well, okay, what sort of case type am I showing? Are you showing, for example, veneers on the front teeth, dentures, implants? So you can then tag those particular photos, much as if you're using, say, Lightroom to organize your images. And you can then say, well, if you're speaking to a patient and you want to show them an example of treatment you provided, like say a white filling on lower first molar, you click on that and it'll bring up a whole series of images which you can then show them. So the use of tags, I think that's a great idea. So Dental Notebox, it's a good app. And I think it's up to a certain amount of data. It's free to use up to a certain amount per month. Hope that answered the question.
I think there's just one more that's just popped up in the box.
Okay, let's have a look. Questions. Mirrors. Okay. All right, there's two ways of sterilizing mirrors, okay? Either you can buy the little cassettes, which have little kind of silicone inserts inside, and you then pop them in and then close the lid down, and then you sterilize those. Or the other way to do it is you take your steri pouch and then you wrap it inside some, let's say, tissue, for example, and then so the mirror is wrapped in the tissues, pop it inside a steri pouch and then put it through the autoclave. All right, and then when you take it out, you're going to get less marks on the mirrors. If you just put it in a steri pouch when it comes out, there's loads of little marks that you then have to struggle to clean off.
Brilliant. I think that's all the questions now. So yeah, thanks ever so much for a great webinar. Very interesting.
Okay, thank you very much.
Yeah, so take care. Yeah.
Okay, take care, stay safe.
Yeah. Thank you. Bye.
Bye-bye.